I am Dr. Vinay Hosadurga, consultant physician at Vasavi Hospital, Kumaraswamy Layout, Bangalore. Today, I will be speaking about a most important topic, that is problems in elderly. That is a geriatric age group or the age group above the age of 60 years. What are the common problems we see in nowadays? Is most important being the neuropsychiatric issues in the elderly. What is this neuropsychiatric issues? That is, commonly as we know, stroke and memory impairment and depression and anxiety disorders are being very common in the recent times. Depression and anxiety in the elderly has been increasing mainly because of the detachment from children. Many people stay outside the country and parents stay alone. That itself initiates many cases of depression and anxiety, which needs to be addressed. Stroke and memory issues will be addressed by your doctor. The solving of all such problems will be explained in detail at the end. Next comes the visual problems like cataract, the increased pressure in your eyes, or any visual disturbance due to diabetes, anything. For this again, you need to consult your doctor on regular basis. Next comes the hearing. The problem with hearing, the problem with tinnitus. Tinnitus is nothing but an abnormal loud sound which is heard in the ear without any external stimulus. This can create many problems for the elderly people who have problems during driving, problem with hearing at home, problem with hearing at work. So this needs to be addressed very aggressively, because if their hearing is impaired during driving, there is a lot of problem leading to accidents. Next comes common problem like heart and lungs. That is risk of heart attack, risk of breathing issues in the elderly, especially because the lung loses its elasticity with age, leading to many breathing issues like pneumonia, dust allergies, breathing issues related to smoke, and viral infections as we commonly see because of suppressed immunity. Next, in the elderly, especially in males, we see some problems with urinary incontinence or urgency in the urination or dribbling of urination due to prostatic issue. Prostate may get enlarged due to age or due to cancerous conditions also. And in elderly females, they have problem called urinary incontinence, that is loss of control in urination, which creates a problem especially when the abdominal pressure builds up, like coughing, sneezing, or due to constipation. Such problems will be addressed by a urologist. And the other problem which we see nowadays is falls in the elderly. Why the elderly people tend to fall? The many issues like memory, vision, hearing, and their physical energy all together leads to repeated falls in the elderly. What happens if the elderly patients fall is head injuries, fractures in the bones, fracture of the back leading to permanent disability, leading to bedridden state. That can lead to bed sores, urinary infection, pneumonia, and it is very difficult to manage a bedridden patient at home. And many times this leads to the family neglect. That should not happen. So we need to take care and prevent falls in the elderly. Next comes most important nowadays, what they say is itching of the skin. Many elderly patients say, I have lot of itching over the skin, but there is no skin lesion, there is nothing over the skin, but they develop itching. It is mainly because of dryness of the skin, loss of production of this oiliness in the skin because of aging. So this can be addressed simply by using coconut oil or moisturizers, which prevents itching in the elderly. And other thing which I wanted to say is hidden malignancies. Malignancy means cancerous condition. That is, many elderly patients, as the age advances, the risk of cancer increases. How to identify this? Any abnormal symptom, any abnormal thing you find in your body, please do consult your doctor. So to identify any hidden cancers which will be missed out. So considering all these common problems in the elderly, I finally wish to say that annual regular health checkup with your doctor will help you to identify or screen your pre-existing disease or a new onset disease or some disease which you do not know. This helps to identify the root cause, treat it early, and prevent many of these elderly issues. Thank you.